The Medical Knowledge Corporation presents The Patient's Guide to Cervical Spine Surgery. This video presentation will answer the most common questions presented by patients who are considering cervical spine surgery. We will review the process you have undergone to reach this stage in your treatment, what to expect after your surgical procedure, and instructions for your recovery. Please review this presentation thoroughly, along with the information and instructions given to you by your surgeon as you take the next steps towards a healthy lifestyle. Before we discuss the operative procedure itself, let's review the process by which you and your surgeon have decided that surgery is indicated for your condition. Let's meet Charles, who has experienced many of the same challenges that you have. Charles remembers that simply turning his head was an agonizing experience.
My neck pain and arm was making life miserable. My work was suffering. I even had to give up the things I enjoyed, like fishing with my son.
Common symptoms associated with cervical disorders can be one or all of the following: pain in and around the neck region, pain which may run down your arms and or legs, numbness and or weakness in your arms and or hands, bladder and bowel control problems. These debilitating symptoms can appear suddenly from a related accident, as they did with Charles, or they can occur gradually over time from degenerative or arthritic conditions. However, when they occur, we know how miserable they can be and how important it is for you to resolve them. That's why you have gone through a number of tests and exams to best determine the cause of your pain and how to remedy it. A quick review of the cervical spine's anatomy will give you a better understanding of your condition. The cervical spine is made up of 7 bones called vertebrae, or vertebral bodies. The uppermost vertebral body is the atlas and is often referred to as C1. The C2 vertebral body is the axis. The remaining 5 vertebral bodies are very similar and are separated by the discs, which act as shock absorbers. These are referred to as C3 through C7. The spinal cord runs down behind the vertebral bodies and is surrounded by bone that extends from these bodies. The nerve roots exit the spinal canal on both sides and at each level. This intricate and complex structure is surrounded by many soft tissues that include muscles, ligaments, tendons, and fatty tissue. Now that you have a basic understanding of your neck's anatomy and the symptoms that have occurred, let's review the methods used in diagnosing your condition. Like Charles, you started with a thorough physical exam by your surgeon and then may have had one or all of the following tests ordered. X-rays. X-rays show the bony structure of the neck. They can be the first step in determining any irregularities that may be causing problems. MRI and CAT scans. These show the bones and soft tissues surrounding the spine and can help determine things such as disc herniations and bone spurs. These images are often used in conjunction with X-rays. EMG nerve conduction velocity studies. These tests help to determine the extent of any nerve damage that you may have. Myelograms. This test places a special dye in your spinal sac, and in conjunction with X-rays, MRIs, and CAT scans, the spinal nerves are highlighted to determine abnormal areas. These diagnostic tests, along with your physical examination, allow the doctor to accurately diagnose your condition and recommend the best course of action to be taken for your recovery. Charles wasn't surprised to hear his diagnosis of a disc herniation.
I knew it had to be more than a pulled muscle. When the doctor told me I had a disc herniation, which was pressing against the nerves in my neck, it made sense. Once they found the problem, I just wanted to get it fixed.
Like many patients, you may have gone through a conservative treatment approach first. Conservative treatments include physical therapy and rehabilitation in conjunction with medications such as anti-inflammatories, muscle relaxers, or epidural injections. In some cases, this may be all a patient needs to return back to his or her normal routine. However, in other cases, a patient like Charles may have to stop conservative treatment early or skip conservative treatment altogether and proceed with surgery as the only alternative for recovery. Like Charles, you have been diagnosed with a condition that requires surgical intervention as the next step. These conditions can be one or more of the following. Disc herniation. Disc herniation occurs when the integrity of the disc has been damaged. Typically, the damaged disc places pressure on either the spinal cord or the nerve roots, which branch off from the spinal cord. Spondylosis. Spondylosis is a condition where bone spurs form around the disc space, nerve roots, and/or spinal canal. Spinal stenosis. Spinal stenosis is the narrowing or constriction of bony passages that surround the nerve roots and/or the spinal canal. Spondylolisthesis. Spondylolisthesis is a forward displacement of one vertebral body over another. Spinal instability. Spinal instability describes a general laxity of the ligaments surrounding the vertebral bodies. These conditions can cause pressure on the nerve roots. This pressure on the nerve roots and its associated symptoms is called radiculopathy. Radiculopathy can cause pain and/or numbness in the neck and possibly down your shoulder, arm, and hand. These conditions can also cause pressure on the spinal cord, which is called myelopathy. Myelopathy can cause pain and weakness in the arms and legs. Myelopathy may also cause stiffness in the extremities as well as a loss of bowel and bladder control. Any or all of these conditions may require surgical intervention. The goal of surgery is to accomplish three main objectives. Reduction, which restores the spine back to its natural alignment. Decompression is the removal of damaged disc material or bone spurs that are pressing on the nerve roots and/or spinal cord. Stability, which is the stabilizing of the spine segments, usually through fusion, which eliminates unwanted motion. All three help in eliminating the symptoms described earlier. Charles was at first reluctant to have surgery, but remembers what life was like before his injury and wanted to get back to a normal way of life. He was confident that his doctor had thoroughly explored every avenue of diagnosis and treatment.
Anytime you hear the word surgery, you get nervous. But after I had spoken with my doctor, I realized that it was the best way for me to get my life back on track.
Like Charles, you have reached the point where your surgeon has recommended that surgery may be the best option in treating your cervical problem. Please remember to always follow specific instructions given to you by your surgeon and the hospital prior to your surgical procedure. The following are some of what you may expect. You will be instructed by your surgeon concerning any alterations in your routine medications, if any, prior to surgery. Discontinue all nicotine products because nicotine may slow down the healing process. Limit your vitamin intake to a multivitamin, although you may take extra vitamin C. Eliminating alcohol consumption is also recommended to avoid surgical complications. Please remember, with any surgical procedure, complications may occur. These complications may include pain, weakness, numbness, advanced degeneration above and below the operative level, paralysis, loss of bowel and bladder control and sexual function, stroke, death, anesthetic risks, blood clots, swallowing and speech difficulties, damage to your trachea, esophagus, and/or carotid artery, broken plates and screws, and a failed fusion. If you choose to have donated bone, you risk the chance of contracting AIDS or hepatitis. If you use your own pelvis bone, there is a risk of infection, fracture at graft site, hematoma, numbness of the legs, and chronic pain at the graft site. Some of these risks may lead to the need for additional surgery. This list is not all-inclusive, and, as with any aspect of your surgery, any questions you may have about these complications should be fully discussed with your surgeon before your consent for surgery is given. Earlier, we highlighted the basic indications for surgery on the cervical spine. Now, we would like to show you briefly what your surgeon will accomplish during surgery. Your surgeon can approach the cervical spine by two different methods. The first approach is from the front of the neck. This is called an anterior approach. Your surgeon will make a small incision along the front of your neck to access your cervical spine. This procedure is a very common and safe way to remove part or all of the affected disc or bone spurs, which will relieve pressure on the nerve roots and/or spinal cord. Once the disc is removed, your surgeon may perform a fusion of two or more of the cervical vertebral bodies in your neck to stabilize the area. This is the procedure commonly called an ACDF. In a fusion, the disc is replaced with bone from either your pelvis or donor bone from a bone bank. Plates and screws may be used to add further stability to the region. This will allow the two cervical vertebral bodies to fuse together and form a solid and stable spine segment. In some cases, the entire vertebral body and disc are removed and replaced with a bone graft to relieve pressure on the spinal cord. This is called a corpectomy. Plates and screws may also be used in this procedure to further enhance stability. For some patients, the surgeon may decide that a posterior approach is the best way to accomplish the surgical goals. In the posterior approach, the surgeon enters from the back of the neck rather than from the front. The surgeon may perform a cervical laminectomy, which removes part of the bony covering of the posterior cervical spine. This type of decompression creates more room for the spinal cord. Stability can also be achieved posteriorly by fusion, using bone graft, plates, and screws. In other cases, the patient may have a combination of both anterior procedure and a posterior procedure, sometimes on the same day, or staged a few days apart. Once the procedure is completed, and after you leave the hospital, much of the success of your recovery relies on your commitment to follow your surgeon's post-operative instructions, which may include the following. Take care of wounds by keeping the area clean and applying ointment once or twice a day to help prevent infection. If your wounds develop redness or drainage, inform your surgeon's office. If you develop a high fever in the first few days after surgery, be sure to call the surgeon's office. If you have any increase in pain, numbness, weakening, or neck swelling, or shortness of breath, call your surgeon's office immediately. If any emergency condition develops, dial 911 on the telephone or go to your local hospital's emergency room. Avoid swimming or bathing for at least 4 weeks after surgery. Wear the cervical brace or collar you have been given as instructed. You may shower 4 to 7 days after the procedure with your brace or collar on. Please remember to avoid all nicotine products and to take all medications prescribed to you by your surgeon. These are small investments to make a full and successful recovery. Just remember that this is a team effort, and your part is just as important to your recovery as your surgeon's. Also, remember that a positive attitude will enhance your results. Please follow your surgeon's instructions carefully and be sure to call his or her office if you have any questions.
I finally feel like I can get back to my normal life. No one should have to live with that kind of discomfort when there is such a positive way of taking care of it. Thanks to my doctor, I can enjoy my life and my family again.
We hope that this presentation has given you a better understanding of the detailed and caring process your surgeon and his staff has undertaken to provide you with the best care possible. If you have any additional questions, please contact your surgeon. We wish you continued improvement and good health.